Hello and welcome to Leicester Spot Diagnosis, the site that uses social media to enhance peer-led medical education. So welcome to this short video. I'm going to take you through intercranial bleeds in the space of about 5 minutes. So there's a lot to get through, so I hope this will be short, sharp and to the point. So intercranial bleeds. So let's look at the layers of the brain. So where can blood collect? Well, you can have blood between the skull and the dura mater. This is an epidural or an extradural hematoma. If we go a little deeper, if the blood is underneath the dura and above the arachnoid, this is a subdural hematoma. If it's in the subarachnoid space, it's a subarachnoid hematoma. If it's in the parenchyma of the brain, it's a intercerebral hemorrhage, and if it's in the ventricles, not shown on this diagram, then you have an intraventricular bleed. So let's look at each of these, the relevant anatomy, the relevant gross pathology, and the relevant imaging findings. So let's find a extradural hematoma on a CT. So here it is. First of all, you notice that it's white. Extradural hematomas occur acutely. 90% of them are associated with a fracture, usually young men with head injuries. You notice it's white because it's hyperdense, it's fresh blood, and other feature which is important, that it is biconvex. You get this lentiform shape or lens shaped hematoma. Let me show you what that looks like in terms of gross pathology. Here is somebody's head. Here is the extradural hematoma. This is the dura mater, which you can see on top. And in cross section, similar to the orientation of what you see on the CT, here is the lens shape hematoma, and this could have well been caused by injury to the middle meningeal artery, which is the classic cause of bleeding, injury to there by a blow to the side of the head. Okay, so lens shape and usually arterial associated with fracture. So let's go down another layer. So if it's not extradural, then it's subdural, and here is the subdural hematoma. So this is an acute bleed. Subdural hematomas can be acute or chronic. This is acute because it's white, it's hyperdense, a little bit of hypodensity here, but it's not biconvex, it's a crescent shape. Okay, so it's crescenteric shape. And let me show you a chronic subdural hematoma. Here it is, crescent shape again, but it's hypodense, so therefore it appears dark. Let me show you what that looks like in terms of gross pathology. Here is a subdural hematoma. Notice the gross distortion to the brain and the midline. Okay, these are usually venous. There's bridging veins which come down through the dura, and when there's often trivial head injury, where there's shaking of the head, particularly in a person who has some degree of cerebral atrophy, that allows for the brain to move more inside the skull with acceleration and deceleration injuries. So these are usually venous, associated with a head injury. It may be up to months ago, which may bleed, stop, and then rebleed after several months. Okay, so we covered extradural, subdural, now it's subarachnoid. So subarachnoids usually come from an artery. Here is one through here, a cerebral artery. They typically come from, the top causes are either a berry aneurysm, which is typically around the circle of Willis, or an arterial venous malformation, which has ruptured and bled. So let me show you what that looks like on imaging. Quite different to the other two. You've got this diffuse whiteness, hyperdensity in the subarachnoid space, even over here as well, and over here, and through here. And let me show you what that looks like in terms of gross pathology. Here we are, diffuse underneath the arachnoid mater. Okay, So these patients present with a sudden, absolutely devastating headache. They often look round to see who's hit them on the back of the head, because this headache comes on so quickly. Okay, and then there's two other types of bleeds to tell you about. So it's intercerebral, which is a hemorrhagic stroke, or into the ventricle, and I can demonstrate both of those on this slide here. This is on radiopedia.org. So it's a scan, go through someone's head. Here we can see the bleed into the basal ganglia, into the parenchyma of the brain, so this is an intercerebral bleed. But look up here, this should be black. This is a ventricle. This side is black, but this side is white, so there's blood in the ventricle. And if we follow this up, we can see blood in the ventricle here. Okay, so let's summarize. So we have looked at extradural bleeds. These are usually arterial, associated with fractures, and present acutely. We looked at subdural bleeds. These can be acute or chronic. These are usually venous and may result from sometimes a trivial head injury, which may be up to several months ago. These are crescenteric on CT, whereas these are lentiform shaped on CT. We looked at subarachnoid bleeds. We said that these are arterial and typically come from arteriovenous malformations or berry aneurysms, and that they are diffuse hyperdensities is what is seen on the CT. We looked at intercerebral bleeds and intraventricular bleeds. For regular revision cases posted, you can find us on Leicester Spot Diagnosis on Facebook. I hope you found intercerebral bleeds in a nutshell helpful. Thanks for watching.